Hi, I'm Dr. Mikkel Jarman here with Pediatric Foot and Ankle, and today I want to talk to you about one of the most common nail problems that we see here in the office, and that is the ingrown toenail. Now, the ingrown toenail is where a corner of the nail actually dives into the soft tissue and causes pain. And this will often cause symptoms of redness and swelling and often an infection. Now, the nail usually will grow straight, but oftentimes that corner of the nail will dive into the corner or dive into the edge and cause that pain. The most common location that we see ingrown toenails is on the big toe, but we can also see it on the lesser, the smaller toes as well. There can be many different causes for ingrown toenails. Number one being the patient improperly cutting the nail into the corner. Second has to do with trauma from sports, athletic activities, or just heavy ground and pound activities. Third has to do with just good old genetics. The patient has a wide nail. And third has to do with shoe gear, wearing an improper shoe where the toe box is just too small and puts pressure on the toes. Symptoms will present as pain in the corner of the nail. You'll see, as mentioned before, swelling, edema. You may also see drainage coming from the nail. You actually may even have a malodor that you may notice. Sometimes we even see the nail will have a soft tissue growth that comes over and on top. When treating ingrown toenails at home, Epsom salt soaks and an antibiotic applied to the nail does help, but for the do-it-yourselfers, it is not recommended to cut the nail out or pull the nail out, as this will often worsen the condition or create an infection. Now, ingrown toenails being one of the most common procedures that we do every day here in the office, we definitely cater towards children. We see children of all ages. We see infants, we see toddlers, we see teenagers, and those squeamish adults too. The procedure is not traumatic. We actually have some very clever ways to help make the toe go to sleep so you don't feel any discomfort. The goal is to remove a sliver of nail. It is that sliver of nail that is cutting into the side of the toe that is causing the pain and discomfort. Now, depending upon the patient's age and the type of ingrown toenail they have, we may recommend a permanent procedure. A permanent procedure is an excellent way to solve the problem not only today and tomorrow, but for the rest of the patient's life. Afterwards, we prescribe a topical or an oral medication to treat the infection. The next day, your child will simply remove the bandage that was applied here in the office, and they will only need to apply a Band-Aid and an ointment for the next 5 to 7 days. Relief from the pain and the infection will actually resolve almost immediately once the sliver of nail has been removed. Now, if your child is experiencing pain in their toe and they have an ingrown toenail, please call our office today and make an appointment. Let us fix this for you. I'm Dr. Mikkel Jarman. Thanks for watching.